Have you been feeling persistently tired, or perhaps noticing subtle changes in your body that you just can't quite explain? Well, these sensations could be more than just fleeting discomforts. In fact, your kidneys might be trying to send you a vital message, one that really needs your attention. You see, creatinine, which is a waste product that your kidneys diligently filter from your blood, provides crucial insights into your renal health. Now, elevated creatinine levels often signal underlying kidney issues, and these can be accompanied by warning symptoms that you absolutely must not ignore. Recognizing these symptoms early is so important because timely intervention can prevent further complications and truly safeguard your overall health. So, let's dive into the top 7 creatinine-linked symptoms you should never overlook. Number 1. Fatigue and weakness. One of the most frequently reported, yet often dismissed, symptoms tied to high creatinine levels and underlying kidney dysfunction is a profound sense of fatigue and weakness. Now, this isn't the ordinary tiredness you might feel after a long day or a poor night's sleep. Instead, it's a persistent, overwhelming exhaustion that doesn't really get better with rest. Many people find that this unshakable fatigue gets in the way of their daily activities, making even simple tasks feel monumental. Because it can be quite subtle at first and is a non-specific symptom, meaning it can be caused by many different conditions, it's often overlooked in the early stages of kidney impairment. However, if you're feeling constantly drained without a clear reason, that's a signal your body is sending, and it certainly warrants further investigation, particularly if other symptoms on this list are also present. The reason why impaired kidney function leads to such debilitating fatigue is directly linked to the buildup of toxins and impurities in your bloodstream. Healthy kidneys are responsible for filtering waste products, including creatinine, from your blood and getting rid of them through urine. When your kidneys aren't working efficiently, these waste products build up, a condition broadly known as uremia. This toxic accumulation can significantly impact various bodily functions, including your energy metabolism and how oxygen is delivered to your tissues. Your body has to work much harder to cope with these circulating toxins, leading to that generalized feeling of lethargy and a noticeable decrease in physical stamina. What's more, kidney disease can also lead to anemia, which is a shortage of red blood cells, and that further exacerbates feelings of weakness and tiredness by reducing the amount of oxygen carried to your muscles and brain. Understanding this connection is the first step towards recognizing that your fatigue might be more than just simple tiredness. Now, while managing fatigue itself can be challenging, identifying its root cause is crucial. And interestingly enough, the next symptom we're going to discuss often goes hand in hand with this internal imbalance. Number 2, nausea and vomiting. Alongside fatigue, feelings of nausea, sometimes even escalating to vomiting, are common complaints when creatinine levels are elevated. This indicates that the body is struggling to cope with the burden of waste products. You might experience a persistent queasy feeling, especially in the morning, or perhaps a general loss of interest in food. For some folks, certain smells, or even just the thought of eating, can trigger these uncomfortable sensations. This digestive distress happens because the buildup of uremic toxins, which the kidneys would normally filter out, can irritate the lining of your stomach and directly affect the area of your brain that controls nausea and vomiting. It's really the body's way of trying to expel these excess waste materials when the main route of elimination through the kidneys is compromised. The physiological link between kidney impairment and these gastrointestinal symptoms is quite direct. As kidney function declines and waste products like urea, which breaks down into ammonia in the gut, accumulate in the blood, they can have systemic effects. This condition, often termed uremic gastroenteropathy, can manifest in various ways, including a metallic taste in the mouth or an ammonia-like odor on the breath, known as uremic fetor. both of which can further contribute to nausea and a reduced desire to eat. You see, the body's intricate systems are all interconnected, and when the kidneys falter in their crucial role of detoxification, the digestive system is often one of the first to signal that something is amiss. These symptoms can significantly impact your nutritional intake and overall quality of life, making it really important to address them promptly. So, just as these kinds of internal discomforts can signal kidney issues, your body might also start to show more visible signs. And that's exactly what we'll explore next. Number 3, swelling in legs, arms, or face. Noticeable swelling, medically known as edema, particularly in your legs, ankles, feet, hands, or even puffiness around your eyes and face, can be a significant indicator of declining kidney function and consequently rising creatinine levels. You might find that your shoes feel tighter than usual or that rings on your fingers become difficult to remove. If you press a finger into the swollen area, it might leave a temporary indentation. This fluid retention occurs because your kidneys are struggling to remove excess sodium and water from your body. When the kidneys aren't filtering properly, this fluid can accumulate in your tissues, leading to that visible swelling. While swelling can have various causes, when it's linked to kidney issues, it often becomes more pronounced as the day progresses or after periods of standing or sitting. The reason your kidney's impaired function leads to such fluid imbalance and swelling is rooted in their critical role in regulating your body's fluid and electrolyte levels. Healthy kidneys meticulously balance salt and water, ensuring that you retain what you need and excrete any surplus. However, when kidney damage occurs, their ability to excrete sodium effectively is diminished. Since water tends to follow sodium, the retention of sodium leads to the retention of water, causing an increase in the overall fluid volume in your body. This excess fluid then seeps out of the blood vessels and into the surrounding tissues, resulting in that characteristic swelling. This symptom is a clear visual cue that your body's filtration system may be under strain. So, beyond this kind of external swelling, changes in your body's output can also offer some really important clues, as we'll discuss now regarding urination patterns. Number 4, changes in urination patterns. Significant alterations in your usual urination habits can be strong indicators of underlying kidney problems and elevated creatinine. These changes can show up in several ways. For instance, you might notice that you need to urinate much more frequently than usual, or conversely, you might experience a marked decrease in the amount of urine you produce. Some individuals report foamy or bubbly urine, which can suggest the presence of protein leaking into the urine, a sign that the kidney's filters are damaged. Another concerning symptom is hematuria, or blood in the urine, which can make urine appear pink, red, or even cola-colored. Furthermore, nocturia, which is the need to wake up multiple times during the night to urinate, can also be associated with declining kidney function, as the kidneys may struggle to concentrate urine effectively overnight. These changes in urination occur because the kidneys are directly responsible for producing urine as a means of eliminating waste and excess fluid. When kidney function is compromised, this intricate process is disrupted. For instance, damaged kidneys might lose their ability to concentrate urine, leading to increased urine volume and frequency, especially at night. If the damage progresses, the kidneys might eventually produce less urine. The presence of foam can indicate proteinuria, where proteins like albumin, which should normally remain in the blood, pass through damaged glomerular filters into the urine. Similarly, blood cells can leak through these damaged filters, causing bloody urine. Paying close attention to these visible changes in your urine and your urination habits can provide valuable clues about your kidney health. Now, another symptom, which might be less obvious but is just as serious when it comes to fluid balance and kidney health, is shortness of breath. Number 5, shortness of breath. Experiencing shortness of breath or dyspnea, especially when you haven't exerted yourself, can be an alarming symptom, and it may well be linked to high creatinine levels and underlying kidney dysfunction. This breathlessness can occur for a couple of key reasons when your kidneys aren't working properly. Firstly, fluid overload, a consequence of the kidney's inability to excrete enough water and salt, which we touched on when discussing swelling, can lead to fluid accumulation in the lungs. This condition, known as pulmonary edema, makes it difficult for your lungs to expand fully and exchange oxygen effectively. This, in turn, leads to that sensation of not being able to get enough air. You might find yourself feeling breathless, even while resting or performing minimal activity. Secondly, kidney disease often leads to anemia, which is a deficiency of red blood cells or hemoglobin in the blood. Healthy kidneys produce a hormone called erythropoietin, often called EPO, which signals the bone marrow to produce red blood cells. When kidney function is impaired, EPO production decreases, leading to fewer red blood cells. Since red blood cells are responsible for carrying oxygen from your lungs to the rest of your body, a reduced number means less oxygen is delivered to your tissues, including your muscles and brain. This oxygen deficit can make you feel breathless and fatigued as your body struggles to meet its oxygen demands. Therefore, shortness of breath in the context of potential kidney issues is a serious symptom that reflects how kidney failure can profoundly impact respiratory function and overall oxygenation. So, moving beyond physical symptoms like breathlessness, it's important to know that high creatinine levels can also take a toll on your mental clarity. Number 6, confusion and trouble thinking clearly. Cognitive issues, such as experiencing confusion, having difficulty concentrating, or noticing problems with memory, can develop when waste products accumulate in the blood due to impaired kidney function and high creatinine levels. You might find yourself struggling to focus on tasks that were once easy, feeling mentally foggy, or having trouble recalling information. Sleep disturbances, including insomnia or excessive daytime sleepiness, can also accompany these cognitive changes and further exacerbate them. These symptoms may develop gradually, making them sometimes difficult to pinpoint initially, but they can significantly impact your daily life and ability to function effectively. The neurological effects observed in advanced kidney disease, often referred to as uremic encephalopathy, are a direct consequence of the buildup of uremic toxins in the bloodstream. These toxins can cross the blood-brain barrier and interfere with normal brain function. You see, the brain is highly sensitive to metabolic imbalances, and the accumulation of waste products can disrupt neurotransmitter activity, alter brain metabolism, and even lead to inflammation within the brain. This toxic environment can manifest as a wide range of neurological and psychiatric symptoms, from mild confusion and lethargy to more severe disorientation, personality changes, and in extreme cases, seizures or coma. Recognizing that changes in your mental clarity could be linked to your kidney health is crucial, as addressing the underlying kidney problem is key to alleviating these concerning symptoms. And as these kidney issues continue to progress, you might find that your appetite and even your weight can be significantly affected as well. Number 7, loss of appetite and unintentional weight loss. A noticeable decrease in appetite, often accompanied by unintentional weight loss, can be a more advanced sign indicating worsening kidney health and progressively rising creatinine levels. You may find that food no longer tastes appealing, or you might feel full after eating only a small amount. This diminished interest in eating can lead to a reduced caloric intake and, over time, significant and unplanned weight loss. While these symptoms can occur with many conditions, in the context of kidney disease, they often signify a more serious stage where the buildup of waste products in the body is significantly impacting overall well-being and metabolic processes. The metabolic changes and gastrointestinal symptoms associated with advanced kidney disease are primary contributors to poor nutrition. The accumulation of uremic toxins can cause a persistent metallic taste in the mouth or even make food taste different, reducing the pleasure of eating. Nausea and vomiting, as we discussed earlier, further contribute to a reduced desire to eat. Moreover, chronic inflammation, a common feature of kidney disease, can suppress appetite. The body may also experience changes in protein metabolism and an increase in energy expenditure, which combined with reduced food intake can lead to muscle wasting and weight loss. Effectively addressing these nutritional challenges is a really important part of managing kidney disease, helping to maintain strength and overall health. Now, those cover the top 7 symptoms, but there are actually a few other important warning signs you should also be aware of. Other important symptoms to watch for. Beyond the 7 primary symptoms we've discussed, there are several other warning signs that can be linked with high creatinine and potential kidney issues. For example, you might experience persistent muscle cramps, particularly in the legs, which can be due to electrolyte imbalances or poor blood flow. Another common complaint is persistent itching, also known as uremic pruritus. This can be severe and widespread, significantly affecting quality of life. Some individuals may develop chest pain. This could be related to pericarditis, which is an inflammation of the sac around the heart due to uremia, or it could be due to underlying cardiovascular disease, which is common in people with kidney problems. An irregular heartbeat can also occur due to electrolyte disturbances, especially high potassium levels, which kidneys normally regulate. It's really important to remember that if you experience sudden or severe chest pain, difficulty breathing, or significant changes in your heart rhythm, it is crucial to seek urgent medical evaluation, as these could indicate a life-threatening complication. When to see a doctor. So, if you're experiencing any of the symptoms we've talked about, particularly if several occur together, or if they are persistent and unexplained, it is absolutely essential to consult your doctor without delay. While these symptoms can sometimes be caused by other conditions, their potential link to kidney dysfunction and high creatinine levels makes a medical evaluation imperative. Your doctor can perform simple blood and urine tests to assess your kidney function, including measuring your creatinine and glomerular filtration rate, or GFR. Early diagnosis and intervention are absolutely critical in managing kidney disease. Prompt treatment can help slow the progression of kidney damage, manage symptoms, and prevent or delay more serious complications, such as irreversible kidney failure requiring dialysis or transplantation. Please don't dismiss these warning signs. Taking timely action can make a significant difference to your long-term kidney health and overall well-being. Recognizing the warning signs linked to elevated creatinine and potential kidney problems is truly a crucial step in protecting your health. Prompt awareness of symptoms such as persistent fatigue, nausea, swelling, changes in urination, shortness of breath, confusion, or loss of appetite can mean the difference between timely intervention and the risk of lasting kidney damage. If you spot any of these warning signs, please don't hesitate to seek medical advice right away. If you found this information helpful, we encourage you to share this article to help others recognize the warning signs of kidney trouble. Why not subscribe for more vital health tips? And please, feel free to comment below if you have experiences or questions about creatinine, kidney health, or related symptoms. Your story might just help someone else take action in time.